This is the Emergency Medical Minute.
All right, good morning, everybody. So this was an interesting study having to do with something that we're doing here. So we started doing, a while ago, we've been prescribing Narcan. We've been doing the take-home Narcan for patients we think that it's appropriate for. In general, it's obviously a good idea and I think the right thing to do. But there was a study that looked at this topic specifically and how many patients with opiate overdose deaths are actually alone at the time of their death and would take home Narcan or Narcan to house matter. So this is a study that was actually done in Australia, and they looked at about 230-some opiate overdose deaths, and of those, 80% were alone when they died. Of the 20% that had somebody with them, half of those, the companion was significantly intoxicated, overdosing as well. So it was a pretty small percent of the opiate deaths that, just having some Narcan there would have made a difference. So I think it's, like I said, it's the right thing to do. It's very benign to talk to you about Narcan, but we also need to go a step further and talk to them about, safe practices, having somebody sober, not even just in the house, but actually in the same room with them. Things like the Harm Action Reduction Center, going beyond just giving someone Narcan, expecting that to fix all the problems. So interesting, quick little study that, when we're doing this, talking to patients about the next step besides just having the Narcan there. Any questions? Thanks, guys.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.